we have an esteemed ladies panel here. I'm feeling lucky. Why don't we start all the way at the left? I'm going to just ask everybody to introduce what they do, themselves, what their company does, and we'll have a nice discussion after that.
Hi, I'm Monisha Perkash, co-founder and CEO of Lumo Bodytech. We use smart sensors and software to track your body's positions, your movements, and patterns, and to be able to give you feedback on your biomechanics. So we have, our most recent product is a posture and activity tracker called Lumo Lift. I'm wearing one now. It's a very stylish pin or brooch. And what happens is when you slouch, it vibrates to remind you to straighten up. It also tracks your steps, calories, and mileage. The reason why we're focusing on posture is it's scientifically correlated with back pain, as well as there's research that shows that when you're in good posture, you get surges of hormones associated with power and confidence. It also reduces your cortisol level, which is related to stress. So there's a lot of benefits of posture in terms of health, wellness, and appearance.
Great, thank you. I'm Anoo, CEO and founder of Smart Monitor. We empower and engage both patients and clinicians in managing some complex health conditions like epilepsy and seizure-related disorders, Parkinson's, to name a few. We have decided to take the whole wearable technology and go the medical route. We are verticalizing it for various disease verticals, and we are providing a platform solution where the family is notified immediately upon the onset of an emergent condition, and doctors have the data that they need to more optimally treat these medical conditions. So we've decided to launch our product for the first vertical dealing with epilepsy and seizures. We've clinically validated it via studies at Stanford and UCSF across both adult and pediatric patients, and we brought the device to market last year. We have more than 1,000 patients using it very well on a daily basis. And as we speak, we are preparing our submissions for FDA clearance of the product.
I'm Noor, Siddiqui. I'm the founder and CEO of Remedy. The product that we built allows any provider, any specialist, to see through the eyes of the provider on scene. So what that means is that a nurse can be wearing Google Glass, use Remedy to show what she's seeing to a specialist, whether that's a neurologist or a surgeon. And basically what we found is that the third leading cause of death in the United States is medical errors. So more people die due to medical errors than from breast cancer. So what we're doing right now is we deployed at Harvard University at 3 hospitals for supervision. So nurses and physician assistants are using Remedy to get feedback in real time and asynchronously from surgeons who are on call at home.
So I'm Melissa Thompson, and I'm the founder and CEO of TalkSession. And our goal is to make mental health care accessible, affordable, and acceptable. And we did this by building a telemedicine platform and increasing the integration of mental health care into primary care and other care settings. So maybe into our setting at some point.
Good. Can we talk a little bit about just the stages? You're all, it's kind of, I think, from most senior to most, well, almost startup in terms of, a little bit reverse in terms of just the stage. Tell us a little about, revenues of the company, or maybe you don't want to talk about that, but number of users. What's been easy? What's been really challenging for you in terms of, the product as you imagined it, and what's the reality of it?
So we're Series A backed. We have 17 people on our team with lots of open positions for product marketing and engineering, so talk to me later if you're interested. We have 2 products. We commercialized our first product last year, the Lumo Back, which is a belt form factor worn around the waist, also focusing on posture and activities. What we learned from launching that product is if you want to be a mass consumer company, which is what we are, we're focused on the consumer market, consumer health and wellness markets. If you're going to ask people to wear something on their bodies, it better be very stylish or almost invisible. And so it was based on the experience of this first product, Lumo Back, that we developed the design for Lumo Lift. We see ourselves as closing the gap where technology meets fashion. And by making it very stylish, providing a lot of different designs and colors to suit a variety of fashion tastes, people are a lot more excited about wearing it because it becomes like a form of jewelry. What we did is earlier this year, we launched a crowdfunding campaign for the Lumo lift, and within 1 month, we sold over 16,000 units at $1.2 million in revenue. We're right now in manufacturing and going to start shipping very soon. We also have relationships with Apple Retail as well as Amazon from our first product, Lumo, and expect to broaden our retail strategy this fall.
Thank you. We are a 2.5-year-old company, and we have been funded by grant funding from epilepsy research organizations, from other healthcare research organizations, and from debt financing. So that's pretty much what's gotten us this far. We are just about closing a bridge round as we speak. This week it is closing, and then we are going in for a larger Series A after that. So our product is already out in the market. We are selling direct to consumer today. And to Casper's question, I think one of the challenges has been marketing it directly to the consumer. Now, we are at the confluence of the consumer and the patient. So there is always a little bit of a question or a gray area about, does the end user pay for it, does insurance pay for it? So again, because we are marketing it as a non-medical product today, it's a very simple smartwatch form factor. You just wear the watch, it tells you time and date and a whole bunch of other things. And when it senses those convulsions, which are similar to those caused by seizures, it immediately alerts a family member within seconds, so they can intervene in a very timely manner and provide the necessary assistance. Because with seizures, it involves loss of consciousness, loss of awareness, and the seizing person needs help, but they are not in any condition to summon that help. So that is really where we come in and alert the family members very, very quickly. That is on the patient safety side. And on the clinician side, what is lacking today, it's very disturbing. If anyone's witnessed a seizure before someone convulsing, it is very disturbing to watch someone have a seizure. So what clinicians are looking for is, how often are these seizures happening? How long are they lasting? And how severe are the convulsions? Data which is very subjective and something that the patient and the family member is not able to provide today. We provide all of the data. We provide audio recordings, video recordings, the timing of the seizures, how long it lasted, how bad were the convulsions. We provide rich, very context-sensitive data to the clinicians. That's made a huge difference. So that brings us back to the confluence of consumer product versus a medical product. We kind of straddle both right now. So one of the challenges has been this who pays for it, the question. So far it's been picked up entirely by consumers. It's all private pay, which speaks to the need for a product like this. But going forward, we are going to get an FDA clearance, and once we do that, that opens up reimbursement pathways. Today we've had some insurance reimbursement, but it's sporadic at best, and it really depends on which of our customers have the staying power to keep working with the insurance companies to keep badgering them for coverage. And so we've had United cover the product, we've had Blue Cross Blue Shield cover the product, and we've had some smaller payers cover the product as well. But again, it's not a given, it's very sporadic, and that's what we are hoping to change with the FDA clearance.
That's great, Anoo.
Thank you.
Yeah, you've obviously taken this approach of working with the insurance companies. How difficult has it been working with the FDA getting a clearance, which you're just submitting that now?
We are just submitting for the FDA clearance. A year ago the answer would have been a little different, but since then the FDA has issued guidances for digital health products, mobile apps. There are so many diabetes monitors that have been cleared by the FDA. So in a sense, all these companies and products have blazed the trail for us. So we are essentially following on that. And our guidance from our FDA consultants and folks has been that it's a fast track clearance and we should be cleared in a few months as opposed to years.
Yeah, it's been interesting because the FDA can't figure out what to do with this. This moving so quickly on the consumer side. They want to have a toe in, or at least a handhold on this, and I think they're being a little bit more lenient just so they can figure out what's going on in this market. Certainly as an investor, I look at this and say, as a traditional healthcare investor, I look at this and the insurers really do want to have an FDA clearance on the product. I think maybe Monisha, do you sell to companies as well, or not yet?
We don't yet sell directly to companies, although we are getting a lot of interest from corporate wellness as well as ergonomics programs.
And no medical insurance, right? I mean, that's the next level up. Yeah.
Correct.
Okay, good. Noor, tell us a little bit about what's been challenging, what's been really rewarding, what do people love?
Sure. So the most learning that has happened has probably been at Harvard. So we just deployed it a couple weeks ago, and we're getting a better idea of what exactly is really valuable to capture on the side of the person wearing Google Glass, and what does the expert need to see to be able to make a treatment decision, to be able to make a diagnosis. So I think a lot of the learning has happened there. Over the last 8 months, we've basically been prototyping and figuring out what exactly should the interface on glass, what exactly the interface on glass look like, what exactly does the expert interface need to be, what are the other features that need to be added on beyond just visuals that make it suitable for a medical setting. So.
And who's going to pay for that? Who's going to pay for this, you think, in the end? Is it the hospital?
Yeah, so I think that
The physician themselves?
some physicians have expressed interest in buying it just for their private practices, but I think that the strategy that we'll pursue is sales department by department,
Yep.
Because that's simpler than selling to an institution, but at the same time, department heads have a substantial budget to be able to support our software. The other option, obviously, is medical device companies.
Yep.
They're also interested in being the payers. But
Good.
I think all of us have that difficult question of, okay, who exactly is going to end up paying for the product? Because
Yeah.
various parties benefit, but who benefits enough that they're willing to pay?
How about you?
So on
Thanks.
payment, we're a B2B2C company. Our stakeholders are the patient, the doctor, and the person who pays for it. So when we're deciding who will pay for it, the barriers to entry in healthcare are just a bit higher. It takes a longer time to go through the product life cycle and IRB. On the positive side, we've partnered with GE Ventures and Health Imagination Initiative and Startup Health Academy and Springboard Enterprises. So I think as startups, it's great to have each other to create critical mass and kind of move each other forward. So that's on the positive side. Challenges, when we talk about doctor in your pocket, reimbursement and licensure issues. We have a lot of regulation, and innovation has really outpaced regulation, and that's, I think, something we all struggle with. So, in medicine, with telemedicine, 44 states reimburse Medicaid, 22 states reimburse the private pay, Medicare on a population density basis, and to get all of those equations perfectly right, you have to get it right.
Yeah.
And so the focus, we have a pilot on the ground with Yale Psychiatry in a private rehab facility for substance abuse, and the private facility pays us directly. But when we get to the payer level, it really is fragmented by state.
And are you going to stick to primarily telehealth, or are you actually going to set up sensors in people's homes, or have them do wearable things?
So I think that ultimately there will be some optical clinical mix. We spend $3 trillion, I believe, in healthcare, and I don't know how much of it is wasted, but a significant amount. So I think every professional should kind of operate at the top of his or her pyramid of skills. So the psychiatrist should be, they can write prescriptions, the psychologist can't. So mixing the different levels where we can optimize costs will be important, and that includes, sensors. We saw the MC10 on the screen. That's almost is a disposable sensor that can give us a lot of biometric data. If we can expand the cognitive boundaries of our providers by providing that data, like Dan said, we can save providers time, optimize their time, bring in specialists when they weren't there before because they had a last-minute cancellation.
Yep.
I think optimization of the mix.
Good. Monisha, do you think you involve at any stage physicians, or once you get to a large data set, presumably you're going to be able to predict certain things when people get to back pain, or what kind of rehab works, or
Yeah, when we first launched the company, we had to ask ourselves, do we want to be consumer or healthcare? And because we knew we were too small to try to do it all, and we would just lose focus. And so we made a very intentional bet that if we started in the consumer space first and developed solutions that delighted them, that would create pull into the medical markets as well as the corporate markets. And we're starting to see that to be true. So already a lot of physical therapists and chiropractors, as well as spine physicians, recommend our products to their patients. And as I mentioned, we're getting the pull from the corporate markets as well. We do see a pathway, to be more aggressive in those channels. And certainly as we're getting more and more data on the consumer side, and to show, in a quantified way the benefits that we're having, for example, in terms of reduced back pain, reduced missed days from work, reduced surgeries, all of those benefits that come from improving your posture. So as we're able to quantify those data, that data will be able to be even more effective in the medical market.
I think what you're doing is great. I mean, it's very similar to what Sunny Vu talks about at Misfit, which is healthcare traditionally hasn't given a damn about the patient, honestly. Physicians do what they're good at, and it's fee for service. And I do think that on the consumer side, if you can, I kind of put this as a sort of a trade-off between friction, so the amount of effort it takes to get the information, and how valuable it is. So the more valuable, the more you're willing to put up with, and you're really going for style, minimum friction, I guess presumably social engagement, all kinds of ways to basically get the information for free, and then provide insight. Does that seem fair?
That's right, and really we've positioned it to really be more of a self-empowerment tool to help bring out the healthier, more confident, more attractive you, right? But what we are doing in the background is we are collecting the data so that we can be able to show the benefits, and as we're in the medical markets, we can be able to reposition our messaging so it is more about outcomes, clinical outcomes, and savings in cost.
Do you feel like you have to connect to other sensors, like a scale? I mean, maybe weight probably affects back pain too?
Certainly, I mean, that's something I get very excited about. Is I think a lot of these sensors and these companies, we live in silos, and we're collecting very, very rich data, and the data would just be exponentially more valuable if we could connect across different platforms to be able to get a more holistic picture of the person. So I was on a panel earlier with Tan Lee from Emotive. Wouldn't it be interesting to be able to correlate posture with concentration levels, or posture with nutrition, or weight, or sleep, and a variety of other biometrics, so that you, like I said, you can get a fuller picture of the person, and whether it is for their own self-empowerment or for the consumption of a healthcare provider to be able to get more insight into the patient. I think it's valid in both directions.
That's great. Anoo, do you find the same? You've got a slightly different use case, right? Are people willing to put up with a lot more friction? So concerned parents, that maybe the kid still says, I'm not going to wear it because I don't like it.
Right. And in this case, it's almost not an option in many cases, because again, I don't want to do epilepsy 101 here, but essentially it impacts people's ability to live independently. It affects their, we have parents of 22-year-olds living with their parents because they can't live alone. And parents still watching over them, not allowing them to go out with friends because they're so paranoid about this. So in many cases, it's really not a choice. We've had, out of all the 1,000+ patients that are using it on a daily basis, we've had a couple of cases where they said the teenagers do not want to wear it when they go out with their friends. But still, when they're indoors, when they're at home and in their rooms working by themselves, they do that because at the end of the day, what it really brings is that peace of mind. That is really what they are buying with that. The peace of mind is the primary thing for the patients and their families. For the clinicians, it's that very precious data. Again, we collect it in a very frictionless manner. All the user needs to do is to wear the watch, just go about doing what they are doing. We don't, it's completely frictionless in that sense, and that's really what makes it attractive. To your question, is it a doctor in the pocket? Once we get our FDA clearance, we are going the traditional route where we make the doctor an integral part of the solution. So the doctors will be prescribing it. Not only that, they will be customizing the settings and the sensitivity of the device and things like that, customizing it per patient. So we see them as a very, very integral part of this whole solution.
I think that's one of the things I've just seen in a lot of companies in the healthcare side, is this idea of logging is incredibly valuable. So the Basis watch, in January, they came out with a really great sleep app, so you could see if you're REM sleep, light sleep, deep sleep. And I showed it to a couple psychiatrists, and like, wow, this would be fantastic because I can't get any I can't get my patients to tell me how well they're sleeping, and this would be fantastic to see, and you know, what's going on with their sleep. I think it's the same thing with diabetes, which is, you know, you're supposed to track your glucose levels and your nutrition, and it's very difficult. Just that it's exactly the same idea as an accelerometer replacing a, you know, a step counter and keeping a log. So I think a lot of that's going to be the same. We're going to see a lot of those things happen in medicine, is really enabling the physician with good patient data.
Right.
So that's interesting. What's the next generation of the product look like? Other sensors? Network sensors? What
absolutely. Other sensors. I think we are fast converging towards that.
Okay.
It has to be a combination of sensors. That's really what gives the total picture of the individual. And that's going to be key. Again, as Monisha alluded to that, today it's been a very siloed approach, but that is going to erode, and we see that happening already. So there is going to be a confluence of sensors, and at the end of the day, today there are about the number of parameters, physiological parameters and vitals that you can monitor, that's finite, it's not infinite. So, you know, and there are sensors to address almost every one of those parameters and the vitals. So I just see that converging. It just depends on what is the primary sensor here and what are the supporting sets of data sets that you want to collect for a certain disease state. I think at the end of the day, it has to be, when it comes to disease management and chronic conditions, the solutions are going to be very verticalized. But there has to be a confluence of sensors, and that's really where we are going as the next step.
So will you have a dedicated device, or do you think whenever the Apple Watch comes out that you'll say, I'll use the accelerometer data and I'll have an app?
Right. I mean, there is always the tendency to go towards that, but even as Samsung has announced their healthcare initiative, and then Apple is most likely going to do it sometime this fall. We still see other hardware manufacturers that are coming up with a whole bunch of different sensors and wearable devices. The difference today seems to be one is medical grade, medical accuracy, whereas the other is more of a consumer type of thing. So really that is where the difference lies today, and at some point it's probably all going to merge. But today the differentiation is the granularity of the data, the accuracy of the data that comes out, and the timeliness of the data.
Yeah, with the FDA you obviously have to have quality systems in place and all kinds of SOPs.
Right.
So let's talk a little bit about, thank you both. How about a little telehealth? What are you finding more difficult? What's easier, you know, relative to communicating with physicians remotely? There's lots of companies now doing sort of MD Live, Teledoc, I don't know, there's like half a dozen, which is really consumer oriented, but both of you are, well, you're consumer oriented, right?
Right, exactly.
But Noor is really more healthcare, in a healthcare environment, so I don't know who wants to start.
She's better dealing with regulation side than I do.
Yeah.
So I think from a clinical perspective, you know, are they comfortable talking to patients from a mobile device? And the answer initially is they're reticent. They want to make sure that they're covering their liability and that they can really see everything they need to see. And the truth is, what we find is, from the physician side, once they do engage in it, they realize that they're getting so much more benefit out of seeing the person in their own environment than seeing them in their office. I mean, if you were to go to a mental health provider and you're as a patient walking into a stranger's office, someone you don't know, and sharing, you know, your private information, and I think it empowers the patient to share more, to be more open, and the clinicians are starting to realize, wow, this is actually very useful for me on a clinical level. So I think that's very positive. And the consumers, the patients, love it. In our initial pilot, we see the reticence to treatment cut in half. Costs have been driven down by 57% in some settings.
So does it make the physician more efficient, or is it really making it more easily adopted by the patient?
It's more convenient.
They're more likely to come in.
Also, we don't have the boundary of geography or time. So if there's a last minute cancellation, you know, people can use ZocDoc, but also in psychiatry fee for service, it's 37 to 45 minutes is the block of time.
It's your window.
If they have a no-show or cancellation, which is 58% of the time, what do they do at that time? They can jump on a tablet and see somebody right there and really drive more revenue to the physician.
That's good. So Noor, I thought you had some really interesting observations about sort of a nurse calling a physician as opposed to using Google Glass. Do you want to share some of that? It's
Sure,
just,
sure.
we talked briefly for the first time yesterday, and it was really fascinating to hear what you're doing.
Cool. Yeah, so telemedicine has been around for 40 years, and yet it hasn't really received mainstream adoption in healthcare. And it's pretty shocking because in the literature, it's really well established that if you institute telemedicine, you see cost savings, you see improved outcomes, and patients are safer. So when we kind of combed through a lot of that literature, we saw that the institutions that received those benefits, the difference between the ones that received them and didn't receive them was very simple. The ones that received them actually used the telemedicine. So the question is, why is telemedicine not getting used? And our intuition, and from speaking to clinicians, is that if they're not getting used because they're too bulky and they take too long to start up. So you can imagine if you walk into a patient room and you're seeing a doctor, do you want to wait around for him to roll in a cart, or to load up some software that takes a long time, or would he be more willing to do it if it just was one press of a button to connect with his colleague in another room or in another state, depending on how rural the setting is. So what we're really trying to do with Remedy is make it really seamless and really easy for any clinician to connect with any other clinician. So obviously for us to succeed, we have to make the right decisions in a lot of orthogonal directions, but the one direction that we're really bullish on is that wearables are going to make a huge difference in the adoption of telemedicine in hospitals. We think that clinicians, from the initial testing that we've done, are using our product a lot more than they would use even a mobile phone, because it's still the screen that comes between themselves and the patient. So that's what we're doing right now.
My experience, I don't know, video conferencing, that's still a nightmare. We've got like $100,000 equipment in the office, and it still takes forever, and it always goes down. So, but there was another interesting part you talked about, which is, I sort of liken this to, imagine we all grew up with email and someone invented the telephone. We'd be like, wow, this is unbelievable. Is the same thing hold true with video conferencing in terms of the information that a physician gets relative to a telephone call? I mean, is there a lot of context that they get? Is there, a lot of cues from the patient by actually seeing them, as opposed to, somebody calling up and saying from the hospital, here, I've got an emergency, what do I do?
Sure. So from just initial testing that we've done, we've seen that doctors feel sleep a lot easier when they're at home, when they can actually see the patient, than when they're just on a phone call. So you can imagine that in a healthcare setting, there's a lot of ambiguity with an audio call, right? So you're describing what a wound looks like. You're describing the pallor of a patient, the gait of an elderly person. These are very, very visual things. Doctors go to medical school for 10 plus years so that they can just look at a patient and tell exactly how sick they are. And the other huge thing, actually, from actually seeing these cases, I don't have medical training, so I saw these cases for the first time, was that how quickly someone's condition actually changes. So you can go from someone's hand looking blue to looking green to looking red, all within the course of 2 hours. So obviously the human mind is biased toward the present. So when you're looking at something, you can't really tell how much has it changed from before. So being able to actually have that objective recorded video of, okay, this is what the color was before, this is what the swelling looked like before, and this is how it's progressed, can really give a doctor a better picture of, is this patient getting better or worse? Are they along a normal trajectory, or are they something very strange is happening?
That's cool. And so, and Melissa, is it really, are you replacing a phone call, or are you replacing a visit? Like, what are you substituting, you think?
Sure. So actually, I should add to the recall bias too of what you remember from the last time you saw a patient to this time, and that's where sensors will come in. Once we have sensor data that's aggregated and we can track patterns and put in thresholds, I think that will be really, really important. The Federated Bureau of State Medical Boards just came out with a policy recommendation that telemedicine consists of video, and the patient has to have a choice of who he or she sees. So I actually think the era of just the straight telephone call, doctor to patient, is going to be phased out.
Interesting.
And video will be more relevant. It is more relevant for clinical reasons.
That'll become the new standard.
Yeah.
And do you think that...
I'm not biased just because I'm a video company.
No. Well, I guess I should, we've got 4 very accomplished founders here. Any questions from the audience? Any burning questions? Go ahead. Who wants to go?
So in my case, telemedicine is not covered by malpractice as a standard. You have to call and add it as a rider policy. And so I think a lot of it's about education. And it's part of the reticence of physicians to adopt new technologies is because they're not 100% confident that their liability is covered. So that's part of what we do as startups go above and beyond for the education piece of it too. We think about bottom-up, top-down marketing. I think of Lumo back and how you're going to the consumer. And from my perspective, we've been trying to go to the institutions and trickle down. So I don't know which is right, but I think relevant from the liability perspective.
It depends a little bit on the specialty in my experience. GP, when you see the otoscope or things like that, I mean, I think some people will struggle, giving a prescription over the phone for a UTI or an ear infection, for example, because they have some liability in doing that. So I think it's actually going to be consumer driven, that consumers will bring the data and say, here, help me understand this. I think physicians are going to be more resistant. I mean, with maybe the exception of Noor, where you're in a hospital environment and it's professional speaking with professional because there's an immediate understanding there, right?
Well, I was just going to say that the malpractice issue, so as of right now, our product is entirely ephemeral, so it's just like a phone call in the sense that as soon as the interaction is over, all the data is deleted, and it's actually because of the malpractice issue. So in the long term, I think that every health interaction will always be recorded, but for right now, institutions are very conservative and nervous about the idea of actually having that data on them and being able to, if something goes wrong, right, the patient coming back and saying, let's roll the tapes and see what went wrong, what exactly went wrong. So yeah, that definitely is a concern, but I think those interactions should be recorded and should be available for review.
Yeah. Tiger Text, I think, is the medical texting app that people use because it disappears after 24 hours.
Yeah.
But it's had some other uses, apparently.
If you're recording it, though, you're putting your data security at a much higher risk.
Yeah.
Especially with video, recording video is expensive, and also
it's got to be HIPAA compliant and all kinds of stuff,
and
right?
even with that, just the risk of having a data breach in healthcare, it's reputationally and financially so high. So.
Yeah, and there's the other friction too in the medical route is with reimbursement, right? Whereas why for us the consumer route was so much more attractive is it's very clear who pays. It's the consumer, assuming you create a product that's good enough that they want to pay. But what we're finding is what healthcare providers love about their patients using the product is they are able to see their data and how they're behaving in the non-clinical setting, right?
Yeah.
It's one thing to observe your patient when they're in your office for 15 minutes or 30 minutes, but to be able to also see how they're behaving in their natural environment is good. But I think that's another nut to crack is in the medical arena is, if we want to sell there, what does that model look like? What does it get reimbursed? If so, under what code? And then helping the healthcare providers understand how to do that. So that's, we go to chiropractor and physical therapy shows, and that's always a question that comes up is, well, can I get reimbursed for this?
Yeah, I think, presumably, certainly with the Basis Watch, the few psychiatrists I talked to said, wow, I'm going to recommend my patients buy this so I can get the information, which was interesting, sort of flip on that. I think it depends also if you're a cardiologist and you've got a patient with implantable defibrillator, you probably don't want to have that call when the thing goes off because you have a big liability. So companies have had to set up their own kind of control center or monitoring center, and then they decide what to do with triaging. Other questions? We're out of time, but one more? Thank you.
There's a question right
Slow. There's
Way
one
back.
more. Yeah.
With the black shirt. That was actually, that was we talked about this a little bit before the session, which is this going to be physician-driven, or is the question, is this going to be physician-driven, or is it going to be algorithm and sensor-driven? Is that the question?
It's a little more on like how well consumers really understand what they're looking at.
It's a great question. I have the same one. So maybe Monisha.
If I understand the question correctly, with the case of our products, it's pretty simple feedback. You know, when you slouch, you get the vibrational feedback. It also tracks your total amount in good posture, so you're able to track your progress over time. You can also see your steps, calories, distance traveled. We push out, reminders and suggestions. We have a gamification level. So I don't really know. So the data consumption is pretty easy based on the way that we've designed our user experience.
Yeah, I think it depends a little on the indication, I think. Anoo?
Right, and I think as your question was about the plethora of sensors and the devices that are flooding the market, how is the consumer to know? And it is difficult. It's pretty much like, it's going to be pretty much like buying a smartphone. There are so many of them, and which one do you choose? And that's why for us, the medical route has given us that clarity, because the physician now decides tomorrow we are going to have 5 different products. Today we have 2. Tomorrow we'll have 5 products, and the physician decides which is the best for this specific patient, and they're also able to customize it, configure it, and give it to them. So I think in that sense, the decision is really out of the customer's hands in that, in that sense, and the physician, who they trust implicitly in many ways still, is the person who is actually provisioning these devices for them.
I guess one thing I do in looking at companies is there good clinical evidence that ties an endpoint or some kind of signal to an outcome? So in the case of epilepsy, it might be tremors, but compare that with, say, I'm going to look at your step data, your heart rate, your tremors, and predict when you're going to get Parkinson's. That's going to take forever in my mind. And I think that will take not only forever, or a lot of time, but lots of data and really smart interpretation. And I think what we see on the certainly traditional medical side is you kind of have to do the controlled experiment if you've got a new endpoint to look at.
Yeah.
I do think that Lumo back, you're potentially going to see things that nobody would have predicted just because you can crowdsource it, but you're looking at a very specific, like back problem related to posture. That seems like a relatively straightforward sensor, right? I think we're going to call an end to this, but thank you all for attending, and thank you to the panel.
Thank you.